Hello, I'm Dr. Ahmad Faisal. I am the president of Mercy Malaysia for the COVID-19 pandemic. I also am a consultant respiratory physician, as well as being an advisor on the advisory panel to the National Disaster Management Agency on health and emerging hazards, which of course includes this COVID-19 pandemic. First and foremost is the adequate supply of personal protective equipment, or PPEs. These vary from simple but hard to get material, such as the appropriate gloves and masks. While there are masks, there are also different types of masks. And for healthcare workers, especially for our frontliners, most of the time they can do with the usual three-ply surgical masks, but there are also occasions, especially when they are dealing directly with ill, symptomatic COVID-19 positive patients, where they probably will need a different type of mask, especially the N95 mask. There are also other parts of the personal protective equipment that ideally the frontliners who are facing COVID-19 positive patients, especially those who are symptomatic, should have. They include overalls that cover the entire body from head to toe, or if they do not have that available, then they will have to make do with the traditional gowns and aprons, which will have to be used only once, preferably, and disposed of after use. There is also another element of this personal protective equipment that is sometimes forgotten, that is covering for the head and face. Most of the transmission, of course, will only occur through the mouth, through the nose, and occasionally through the eyes as well. And so the other part of the PPE which is important are the face shields, as well as eye goggles when appropriate and necessary. These are not easy to get at the moment. They are not very expensive, they are not very high-tech, but they are difficult to get. Those who are involved in more highly intensive situations, there sometimes may be a need for other types of more specific and specialized equipment, especially for those treating patients in the intensive care units. This is the challenge that a lot of them are facing. Let's pray and hope for the best. Thank you very much.